Hello, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 5 third-year Bachelor of Science in Nursing students here at Vancouver Island University, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We would like to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people, with a broadcasting range that overlaps the Powhatan and Tla'amin territories. This acknowledgement is done with gratitude to the Snuneymuxw people, and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. I'm your host, Habin, and today our episode will be focusing on supporting someone struggling with their mental health. We're going to talk about the supporter role, how to maintain healthy relationships to avoid caregiver burnout, provide you with some resources, tips, and suggestions to help you best support the person you care for while looking after yourself as well. During this episode, we also have the pleasure of interviewing Ashley from Thrive to talk about how VIU is supporting mental health to their students, staff, and faculty, as well as Sykes from the BC division of the Canadian Mental Health Association, joining us today to talk about the importance of community engagement to raise awareness and battle the stigma around mental health, and tie this topic to sustainable goal number 3, good health and well-being, so make sure to stay tuned. Before we continue further, I just wanted to let you know that if you want to learn more about anxiety, depression, or caregiver burnout, or other specific topics, please check out our YouTube page at A Sound Constitution to listen to our previous episodes that specifically delved into each of these topics.
You can't tell how someone feels just by looking at them or what they share online. To the outside world, our lives may look perfect, even if in reality they aren't. I'm always worrying about doing well at school, and with the end of year test coming up, I'm not sure how much longer I can cope. My thoughts swarm around my head, sometimes keeping me up all night. Some days it's just all too much, and I feel like I'm lost in space. When I did badly on one of my tests, I just about kept it together until I got home. Then I broke down crying in front of my mum. She listened for a bit, and then she told me that, just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, angry, and stressed is a normal part of life. Just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. These are everyday feelings. Good mental health means experiencing negative emotions. It's not always about being happy. Mum can relate to the feelings of stress. So when Mum suggested I take a break from everything and do something I enjoy, I actually took her advice. So I made myself a hot chocolate, snuggled up in a duvet and watched a film. And you know what? Afterwards I felt so much better. Mum should take her own advice.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her, so I tried them too, but it didn't make much of a difference. Even when I tried to be around my friends, I felt alone. The things I used to enjoy weren't fun anymore.
I was really worried about Andre and not sure what to do. He was quiet and wasn't hanging out with us like he used to. So I asked our head of year for some advice. He suggested I get Andre to speak to him since his negative feelings weren't going away.
I didn't want to speak to our head of year, but I also didn't want to keep feeling so down, so I went. He said that sometimes we have overwhelming feelings that can be more intense than our everyday feelings. These feelings hang around for a long time and change the way we feel, think, and behave. They can stop us doing what we want to in life. That's what I was going through. He also said that if we're physically unwell, we let people know, we ask for help. It should be no different with mental health. Sometimes our overwhelming feelings are brought on because of things in our life. Sometimes they happen for no reason at all. After hearing this, I felt much less alone and it felt good to talk. Scientists have found exercise can help when you're feeling low, so our head of year encouraged me to sign up to the school football club, which Sasha was already in. I still have days when the river is there, but now I'm beginning to understand my mental health. I'm learning how to cope. Our head of year reminded me that my friends, family, teachers, and lots of others at school are there to help just as much as he is. I had no idea the people around me could be so understanding. And while it's not always easy to talk about my mental health, the person I'm talking to might be able to help. If you don't feel like talking, that's fine. You could try writing, sports, reading, art, music, playing with your pet, whatever makes you feel better.
If you're the person someone talks to when they're struggling, just listen with no pressure or judgments. You don't have to have the answer. If you feel unsure about anything, you can speak to a trusted adult. Talking about mental health doesn't have to be difficult. After all, it's something we all have.
That was the audio clip from a video called We All Have Mental Health by Anna Fraud National Center for Children and Families. And like that audio clip said, we all have mental health needs that need to be taken care of. Here's a stat about how prevalent the mental health issue is in Canadians.
According to the Canadian Mental Health Association, in any given year, 1 in 5 Canadians will personally experience a mental health problem or illness.
First of all, supporting someone struggling with their mental health can be very, very challenging. Since you care for them, it can be hard to draw boundaries and face practical, financial, and emotional problems from time to time. Of course, there is no one-size-fits-all method to support someone. How you care for them will depend on you, the person you care for, and the situation, which can be very overwhelming. Plus, it's hard to see someone you love in pain, and it's confusing when someone you know well is not acting like themselves. But you have to remember that you're not their therapist or their doctor. You're there to listen and be there for them. And sometimes, despite our best intentions, things can go the wrong way. So here are some key points to help you support someone who may be struggling with their mental health. Learn about the illness. This can help you understand how it affects the person you care for, while helping you feel a little bit more confident. Learning about the associated medications and its side effects are helpful too. You can learn about mental illnesses by contacting local services or searching online, but make sure they are trusted websites. A great place to start is a non-profit society called BC211 that connects people to community, health, and government resources for help. You can call or text 211 or visit the website at bc211.ca, where you can find an online directory to find services by topics, such as counseling, financial assistance, legal and advocacy, mental health, and many more. We will also have other resources available in our show notes, so make sure you check them out on our social media pages. However, don't forget, you can always ask the person you're supporting about what symptoms they get when they're becoming unwell and about the medications that they're taking, like when they take it and if they have any side effects. These things might help you recognize when something is wrong or right and when to get help. Secondly, seek help from professionals, which is best demonstrated by encouraging your loved one to seek help on their own, which allows them to be in control. This can be by going to the doctor, a counselor, or local mental health services. And we can be important parts in this too. We can advocate for our loved ones to get the help they need, and a key in letting the professionals know what's going on, filling in parts when needed. However, you might find that the person you're supporting doesn't want to get the help. And this might be because they don't think they need help, or the treatment won't work, don't understand that they are unwell, or think that things will get better on their own, or maybe feeling scared, worried, or feel hopeless and reluctant because of previous experiences. And if this is the case, it can be very frustrating because you care about their well-being. But try to be understanding because this can be very scary for them. To learn more about how to approach someone who is reluctant to getting help, check out our show notes where we'll have some resources to guide you. In the best case scenario, your loved one will be inspired by your encouragement and they will go to the hospital or wherever else they need to get treatment on their own. But in some cases, it may be necessary to receive treatment under BC's Mental Health Act. It's an act that allows the hospital to admit and treat people with serious mental health needs, who's a risk to themselves and or to others, typically only as a last resort. To be certified for involuntary mental health treatment, a person must meet 4 requirements. The first one is they have a mental health disorder that seriously impairs the ability to live in the community. Second, requires psychiatric treatment in a designated facility. Third, requires care and supervision to prevent deterioration or protect themselves from others. 4, cannot safely or adequately be treated in a community-based facility. To learn more about the Mental Health Act, you can go to heretohelp.bc.ca and search up Mental Health Act, or go to bcmhsus.ca. The direct links to the Mental Health Act information on these websites will be available on our show notes, on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or on YouTube, A Sound Constitution.
One important aspect of being the supportive role is knowing your own limits, knowing that you need to take care of yourself as well. So give yourself time to rest and process what you've been told or what's happening. In order to be the supportive person for somebody else, you need to be supportive of yourself first.
You can support people before they experience a mental health crisis in the following ways. 1. Working with the person you are supporting to identify their early warning signs of a pending crisis. 2. Communicating with the person you are supporting about what they consider as a helpful level of self-monitoring and peer support. 3. Emphasizing that setbacks are normal, it's how you respond to those setbacks that is important.
To everyone who's tuning in now, you're listening to A Sound Constitution on CHLY 101.7 FM. Another way to support the person you care for who's struggling with mental health is by supporting a healthy lifestyle. And this can be having a good diet, getting exercise, staying active, and sleep are key to health, especially when you're struggling with your mental health. It's going to help improve mood or help with some of the side effects of medications. Trying diet or exercise plans with a person you care for can help add routine and structure to your days. Inviting the person you care for to a walk or other places can help you both have a routine of getting out. But if the person you care for can't leave the house, there are also other methods of staying active in your house. You can try some free exercises on the internet, or they can do what they can to help around the house, like preparing for meals or cleaning. Providing emotional support is super important as well. Try to be as supportive, understanding, and patient as possible. They are not to blame for their illness, but they may feel that they are, or may be getting that message from others. So providing emotional support can help them, who's not feeling well, feel less alone and ashamed. However, remember that you will need emotional support as well. Taking care or supporting someone who is ill can be very stressful. You need to look after yourself too.
So as we're being there for someone, it's really important that we know our role. We're not this person's counselor or their psychiatrist or their teacher. We're just this person's friend or sibling or teammate, just someone who cares about this person. And as such, we should just be there to support this person throughout the conversation. But while we're doing this, we want to make sure that we're setting boundaries so that we're not having any negative impacts on the friendship and that we're not crossing any lines. We also want to make sure that we're aware of our biases so that they're not having any impacts on the conversation as well. You also want to make sure that throughout the conversation, wherever you can, you are mentioning other resources that this person can use just so that they can get any help that they need and so that you can just be there to support that person.
That was the audio clip from Be There organization called Know Your Role. And like that audio clip said, know where you stand in the relationship. Being there for someone does not mean you become their therapist, personal assistant, or primary caregiver. This is when setting boundaries is especially important to maintaining healthy relationships. The term boundaries might feel negative, that you don't care enough to do these things for your loved one, but that's not quite the case. Here, try thinking of it this way instead. It's basically like setting rules about your role, your capacity to do things, because you only have so much time, energy, and emotional bandwidth. You cannot be the only person for support. They need a support system, which is where professionals can come in. And also, setting boundaries can help to protect your own mental health. It's possible to have empathy for someone else while also having boundaries. Here are some tips on setting boundaries. First, be upfront about it. It's okay to let your friends or loved ones know that you're not in a place to support them at that time, so you could encourage them to seek help elsewhere. Continue to do things you'd usually do together. Don't let the relationship become all about support. Be open to change. The situation might change, and so will your capacity to be there for someone. And don't be afraid to reassess your limits and communicate them. And so, revisit the boundaries you set if you feel that you're drifting beyond them. And make sure you tailor it to your situation and what your loved one's needs are. Now, those were just some tips on setting boundaries. If you want more information about setting boundaries, go to bethere.org. Thank you for listening to A Sound Constitution here on CHLY 101.7 FM. Coming up now, my co-hosts, Amanda and Taylor sat down with Ashley from Thrive at VIU. Together, they had an engaging discussion about how VIU is promoting good mental health for their students, staff, and faculty.
Hi, Ashley. Thank you for joining us on A Sound Constitution.
Hi, thank you so much for having me.
Yeah, it's a pleasure to have you here today, Ashley. Can you tell our listeners a little bit about yourself and your role at Thrive?
Yeah, so I'm a third year nursing student at VIU, and I've been a student wellness promoter on campus since 2019. I'm starting the program. And with Thrive, I've been helping with wellness type activities on campus, such as a Talk to Me program, and most recently, just Thrive. When I'm not busy studying, I love yoga and hiking and spending time with my friends and family.
Well, that's so exciting. So you told us a little bit about your role in Thrive. I was wondering if you can tell us more about Thrive itself. What exactly is Thrive?
Yeah, so I like to describe Thrive as a big umbrella term for all health and wellness on campus for students, staff, and faculty. It's to sum it up, it's basically a collection of activities, events, and resources to help you and whether that's students be well. There's something for everyone, and that's whether you only have 5 minutes or 5 hours. So Thrive is really there just to support your mental health and well-being. They offer many events, workshops, resources, both in person, on campus, as well as virtually since the pandemic over Zoom. And then we also do a lot of social media campaigns on our Instagram and Facebook pages.
Well, we'll be sure to grab those social media pages from you to share with our listeners as well. So how is Thrive promoting the well-being specifically to students and staff here at VIU?
Yes, like I mentioned, so Thrive offers a variety of different events, resources, activities for the VIU community. One thing that Thrive does, it does pop-up style events throughout the semester to share mental health resources and various other resources that are available to students on campus. For example, we recently last semester had an event called Take a Wellness Break, and it was just before the exam period in the fall semester. And there was a campfire, there was free hot drinks, there was positive affirmation cards, and it was really an opportunity for others to kind of connect with the Thrive team or other students on campus. Another thing that Thrive does is it has a new program called Thriving in Action. It's currently running this semester via Zoom. It's basically an evidence-based program based from Ryerson University that combines a positive psychology and innovative learning strategies to support students in developing skills and then having the resiliency to thrive. There's also within this program, there's a variety of sessions with different themes. Some of the themes have been finding your center, how to manage your time and avoid burnout, positive thinking, study tips, self-compassion, and how to rock finals. And one of our newest offerings on campus is a wellness lounge, and that is run by the Wellness Peers. And they're basically students who just love to connect with others. So the Wellness Lounge is a space in the library that's dedicated to just hang out, relax, and chat. There's comfy chairs, there's fidget spinners, there's coloring pages, there's free tea and hot chocolate. And the best part is that there's therapy dogs. So the therapy dogs have actually been such a hit. Like, who doesn't love to cuddle with a puppy?
That's so cute. I have been meaning to access the therapy dogs. I think they're really neat that we bring them on campus. And so are they going to be there more often?
So they're there throughout the weeks, various times. So a good place to check out would be on the campus website or on our social media pages. So at VIU Thrive on Instagram.
Oh, I had no idea.
We'll have to be sure to check that out. It's really clear to me that Thrive has a lot of resources for students. What I'm wondering specifically about is what resources are available to students who find themselves experiencing mental health issues.
Good question. So some of them would be, one of them at least, would be the Health and Wellness Clinic at VIU. So this offers students an opportunity of a session with a nurse practitioner or counselors or various advisors who you can speak to. And like I mentioned, the Wellness Peers are in the library, and they're also a great first step if someone just feels more comfortable approaching another student versus a professional. And sometimes that can kind of break that barrier. And you don't have to book an appointment. So it's just a drop-in basis. And then lastly, accessibility services. So they provide information, support services, and they can provide accommodations to students for a variety of different conditions.
That's really good to hear that there's so many resources. Are there any particular strategies that you have observed that have worked well in this case?
So out of the resources that I've mentioned, I'd have to say that they're all great resources for anyone who needs them. And then I feel like basically everyone has different needs. It's hard to pick what works for one person and how that might not maybe work for someone else. But I can speak personally on utilizing accessibility services. It's really helped me be successful in all my classes when the pandemic hit. And all my classes were pushed to being online and all my exams were online. But I really think it's dependent on what your needs are, but just kind of being open to accessing resources that you may need. And that could just maybe even just being speaking to someone.
First of all, you're right. It's not one size fits all for everyone. Everyone has unique mental health needs. And so it's really nice that there's a lot of accessibility on campus for mental health resources and that Thrive is helping students connect with those mental health resources. I'm wondering what advice you would give someone who is struggling with their mental health.
Good one. So not just recognizing and acknowledging that not being okay is okay, being open to seeking support and really utilizing your support system. And that could be like a friend, a family member, a grandparent, neighbor. And just like we've mentioned, some of the sports on campus, really utilizing the different supports available on campus. There are so many. And that can be just talking to an instructor, visiting the health clinic on campus, speaking to one of the wellness peers in the library. And another piece of advice that I have is not compare yourself to others. So sometimes I feel like we're seeing so much on social media, but it really does mask reality. And quite frankly, everyone in some way is dealing with something at some point in their lives. And we just don't know about it. And then my last piece of advice would be do things you enjoy. So I feel like life gets challenging. And it's really important for us to have self-compassion. And for me, that's going to yoga every day. It helps me maintain a positive mental health, and it offers me kind of time to just let go of my day and just focus on my breathing during my practice and just, put aside things that I still have to accomplish that day, whether that's at work, school, or the errands I have to run after my yoga class.
Yeah, I have to agree, like what you said about just not comparing yourself to others. I find that's pretty relevant as a nursing student as well. Like others get more experience than you in certain areas and you're kind of like, oh, am I falling behind? But then you just sort of have to think like I've had other experiences and I may excel more in this area than someone else, but vice versa, right? Is there anything else that you would like to share with our listeners before we end?
I can share one of my favorite quotes if that's okay.
Sure, we'd love that.
Everyone you meet is fighting a battle in some shape or form you know nothing about. So be kind always.
That's so nice. A nice way to end it.
Well, Ashley, thank you so much for taking the time to come and sit with us and talk about mental health and talk about services that are available to students at VIU and for discussing Thrive, because I feel like I've learned so much today.
Thank you so much for having me on this episode. I'm so grateful to be here with you too.
We will see you again soon.
Thank you. Bye.
That was Amanda and Taylor interviewing Ashley, a student wellness promoter at VIU, giving us some context on some of the resources available at Vancouver Island University and how such resources can be beneficial to our mental health.
What are the signs and symptoms of somebody who may be struggling with their mental health? Understandably, signs and symptoms can vary depending on the disorder, circumstances, and other factors. Mental illness symptoms can affect emotions, thoughts, and behaviors. Examples of signs and symptoms include feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends and activities, significant tiredness, low energy or sleeping problems, detachment from reality such as delusions, paranoia, or hallucinations, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, problems with substances such as alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, and suicidal thinking. If you have any of these signs or symptoms, or you are worried about your wellness, we encourage you to seek out your primary care provider or a mental health professional. If you have a loved one showing signs of mental illness, have an open and honest discussion with him or her about your concerns. You may not be able to force someone to get professional care, but you can offer encouragement and support. You can also help your loved one find a qualified mental health professional and make an appointment.
You're listening to A Sound Constitution on CHLY 101.7 FM. Positive mental health and well-being is a resource for everyday living, just like our physical health. Having good mental health allows us to stay balanced, enjoy life, cope with stress, and bounce back from major challenges. And to have good mental health, it's important to practice self-care. Self-care essentially means a conscious act that you take in order to promote a healthy physical, mental, and emotional health. And there are many ways you can do this. It can be as easy as stepping outside for a few minutes to get some fresh air. Self-care helps us cope with stress and builds resiliency towards those stressors. However, self-care is often viewed as a luxury rather than a priority. But self-care isn't just about finding ways to relax. It's about taking care of yourself, whether that's mentally, physically, emotionally, socially, or spiritually. Here are some ideas for you to do self-care. Go for a walk with a friend. Do something that you enjoy, maybe a hobby. Meditation or yoga can help you relax. Or try doing something fun and active. Or if you're someone like me, something relaxing, like watching a movie or reading, are ways for you to do self-care. And these are all ways to practice self-compassion. It doesn't have to be something super hard or challenging, and by practicing self-care, you can prevent burnout. If you or someone you care about is struggling with mental health, please call the BC Mental Health Support Line with no area code at 310-6789. If you are in distress or worried that someone will take their life, please call the suicide hotline at 1-800-SUICIDE or 1-800-784-2433. Or to chat online with a crisis responder, visit crisiscenterchat.ca. It's available from noon to 1 a.m. every day. For kids and teens ages 20 and under, professional counselors are available to help 24 hours a day through the Kids Help Phone, which can be reached at 1-800-668-6868 or visit kidshelpphone.ca. Or to chat online, visit youthinbc.com. This is available from noon to 1 a.m. every day. The Seniors Distress Line can be reached at 604-872-1234, and this is also available to anyone who is concerned about an older adult. If you want to access free, non-emergency health information, including mental health and substance use information, call 811 or visit thehealthlinkbc.ca. Through 811, you can also talk to a registered nurse about symptoms you're worried about, or talk with a pharmacist about medication questions. The alcohol and drug information and referral service can be reached at 1-800-663-1441. Now, these are just some of the resources. Please check out our show notes to access more. Our Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or YouTube at A Sound Constitution. And we'll be back after a short audio clip.
All of us, at some point in our lives, are affected by mental health problems. We might have mental health problems ourselves, or know someone who does. Conditions range from the most common, like depression and anxiety, or problems with alcohol or drugs, to bipolar disorder or schizophrenia. It is well known that poor mental health contributes to physical health and social problems. It also results in economic loss for individuals, families, and communities. And people who experience mental health problems are often socially isolated or at risk of human rights violations. Yet, even though poor mental health has serious consequences for whole societies, it remains one of the most neglected areas of global efforts to improve health.
You just listened to the first portion of World Health Organization's Special Initiative for Mental Health. Like how they mentioned, mental health and physical health are interlinked. Sustainable Development Goal number 3 addresses overall health, which includes mental health. The goal's purpose is to ensure healthy lives and promote well-being for everyone at every stage of their lives. To get a better understanding of SDG 3 and mental health, let's listen to an audio clip from the organization called the Academy of Medical Sciences.
Within low and middle-income countries, poor mental health is increasingly recognized as a pressing challenge for individuals, families, and communities, as well as a significant economic burden. While biological factors are important, social determinants are now understood to play a key role in people's mental health. However, there is still little focus on the social determinants of mental health, which could help identify vulnerable groups and are crucial to developing effective interventions. Following our first global mental health meeting held in 2018, the Academy of Medical Sciences convened a follow-up workshop to develop an overview of current knowledge of social determinants and to identify barriers and obstacles to tackling mental health problems. Discussions were shaped around 5 domains, aligned with the Sustainable Development Goals: demographic, economic, environmental events, neighbourhood, and social and cultural. A number of themes were identified as being relevant across the 5 domains, and participants identified actions key stakeholders could take in order to address the cross-cutting issues. Researchers need to focus on crucial research gaps and ensure research culture and infrastructure supports productive working. Policymakers should make sure policies consider and work to positively impact mental health. They are also well placed to collaborate with researchers and organisations to advocate for issues that affect mental health. Funders need to support diverse research on mental health and ensure consideration of mental health across all the areas they fund. And there is a role for civil society. Organisations should integrate mental health in their work and build relationships to create impact across other sectors. The cross-cutting nature of mental health over many domains was evident throughout the event, with participants emphasising the need for greater collaboration to fully understand and address the social determinants of people's mental health. To find out more, download our report.
For those just tuning in to A Sound Constitution on CHLY 101.7 FM, we just listened to an audio clip from the organization called the Academy of Medical Sciences. It's their video titled Addressing the Social Determinants of Global Mental Health in the Sustainable Development Goal Era. The United Nations Sustainable Development Goal report from 2021 says that more than 700,000 suicide deaths occurred in 2019 globally, with men nearly twice as likely as women to kill themselves. Suicide is among the leading causes of mortality among people aged 15 to 29, constituting around 8% of all deaths in this age group. Additionally, it's a huge concern that suicide will be increasing due to the pandemic. A World Health Organization survey showed that 90% of countries in early 2021 reported that mental health and psychosocial support were included in their COVID-19 response plans. So, the need of support for mental health is being recognized in vast majority of countries. COVID fatigue, caregiver burnout, mental health illnesses, and other health consequences can contribute to poor mental health. However, There are also other aspects such as economic consequences of the pandemic, which is another particular concern as well. And so steps will need to be taken to ensure appropriate safety nets are in place for people facing financial hardship, especially when they are struggling with their mental health. Let's listen to an overview of the global challenge of mental health and the Lancet Commission's guiding principles and recommendations for change.
So, why does the world need a commission on global mental health and sustainable development? Because mental ill health is on the rise worldwide, causing early deaths and fueling cycles of poverty. Most people with mental health problems do not receive care, which prolongs suffering and leads to colossal societal and economic losses. Even worse, they are often subjected to human rights abuses and discrimination. To respond to these challenges and help achieve the Sustainable Development Goals, the Commission outlines a comprehensive blueprint for action. This Commission has 3 unique guiding principles. 1. Our approach to mental health covers the full spectrum of mental health, from day-to-day wellness to long-term disabling conditions. We know how to promote mental health, prevent mental disorders, and enable recovery. It's time to use this knowledge to benefit entire populations. 2. Mental health is the product of psychosocial, environmental, biological, and genetic factors interacting with neurodevelopmental processes. Because our experiences in childhood and adolescence shape our mental health for life, it is crucial that these years unfold in nurturing environments, which promote mental health and prevent mental disorders. 3. Mental health should be respected as a fundamental right by putting people living with mental health problems at the center of planning services and challenging stigma. Everyone is entitled to dignity, autonomy, care in the community, and freedom from discrimination. What are the Commission's recommendations? The Commission calls for increasing investment to realize these aspirations, improving services as part of universal health coverage, and recognizing that everyone, everywhere, is entitled to good mental health. These changes rely on a diverse range of groups, from the mental health and development communities to policymakers and civil society, coming together as a global partnership to improve mental health worldwide as part of the Sustainable Development Goals movement. To learn more about the Commission's call to action, visit www.globalmentalhealthcommission.org.
You're listening to A Sound Constitution on CHLY 101.7 FM. And coming up next, we have an interview with Lauren, who will give us more insight on addressing mental health as a community.
Hello, everybody. It's Taylor, and I'm here with my co-host Amanda. Joining us today, we have Lauren Sykes, who is the Resource Development and Events Coordinator in Victoria for the BC Division of the Canadian Mental Health Association. Hi, Lauren. How are you? And thank you for joining us today.
Hi. Yeah, thank you so much for having me.
We're so glad to have you here and to discuss mental health as well as community engagement with you. Can you tell our listeners a little bit more about yourself and your role at CMHA as well as Youth 2020 Canada?
Yeah, so my name is Lauren Sykes. As Taylor said, I'm the Resource Development and Events Coordinator for the Canadian Mental Health Association BC Division. I work at our Victoria office, which is located in downtown Victoria. I work in the fundraising and event planning team at CMHA. And on March 17th, 2022, I'll be hosting a workshop for Youth Can 2020 on the topic of community engagement, awareness, and battling stigma.
Yeah, so you're involved with the Youth 2020 Can, the Living in Color workshop. What encouraged you to focus your workshop specifically on mental health and community engagement, and why is this important?
Yeah, so I was actually approached by Gwen and YouthCan 2020 to present on this topic. Community engagement and battling mental health stigma is a large part of my work at CMHA, so it was a very natural choice. And working for CMHA, mental health is, of course, very important for us, specifically promoting positive mental health, like developing strategies and coping skills. Every person has mental health, and that's part of the destigmatizing we need to do. We need to learn and teach ourselves how to take care of our minds the same way we do our bodies, because it's just as important. And when we neglect our mental health, there's a real impact on our quality of life and overall health.
Yeah, I definitely have to agree that the destigmatization of mental health is an important step at promoting mental wellness. How do you think we as a community can battle the stigma associated with mental health?
Yeah, talking about it, sharing stories, that's one part of it. Obviously, stigma has a huge effect on whether an individual seeks help or not. And we should, as a community, uphold the value that seeking help is okay, acceptable, and normalize it. But I think a really key part of that is structural change as well, such as employers, school boards, and our government valuing the mental health of their people. It would be a massively positive movement if all employers were required to give their employees mental health days, or for schools to teach youth to develop healthy mental health habits at an early age. As a community, if we encouraged any institution or business to uphold valuing mental health, then that would be a huge win against stigma.
I think that's really interesting that you mentioned, adding mental health supports in the workplace. I think that's something that I personally advocate quite often in my own life, having been a mental health support worker and with my own experiences on the front line. It can be very challenging to navigate mental health services and mental health clients in a way that's healthy for you. And so it's really nice to hear that you're advocating for mental health services for employees.
Yeah, just to add a little bit onto that as well, we had such a positive example here at CMHA. At the start of the pandemic, we were given certain mental health days that we could take whatever we wanted, because there was that recognition that with COVID and with everything happening in the world, like sometimes you just need to take those days. So just having that come from my employer was huge, and so definitely should be something that's more available in the workplace for everyone.
Yeah, I love that. I love that type of support. You don't see it very often, unfortunately, in the workplace. So what advice would you give to someone who is struggling with their mental health?
It is always okay to ask for help and talk about it. I know it can be hard, especially with the pandemic. Many people have felt isolated or alone, but there's always someone that you can talk to. Find a mental health service or program that fits you and your needs. We're lucky in BC and Canada to have so many programs and organizations. And again, because of COVID, a lot of these programs have become more accessible. There are a lot of really comprehensive directories out there like BC 211, Here to Help, and pathwaysbc.ca. I'll admit it can be a bit overwhelming because of the amount of resources out there. I personally like to search on pathwaysbc.ca because it collects data such as the cost of a program, if it's delivered online, by phone or in person, the referral process, all of that. You can search by those parameters as well. So it makes it very accessible, very approachable.
Yeah, thank you so much for sharing that information and advice, as well as the resources you found useful.
So what are some ways that you like to self-care?
So I love to go for walks with my dog. It's a very basic thing, but just 15, 20 minutes around the block with my dog is the best thing. I also really like to just do self check-in or check-ins in general with my friends. When there's positive moments, but also when there's, not so positive moments. Again, it all circles back to sharing your story and just being open about your mental health and stuff. So I find if I'm in a bad mood and I check in with my friends, they'll be like, you know what? Well, we're going to do something about this. So yeah, those are two ways that I focus on my self-care.
Aw, Yeah, that's great. What's your dog's name?
Mira.
Mira.
Yeah.
Yeah, I have 2 dogs as well, and I do think like even getting out for like 15 minutes is a huge, and just like having them around in general, like to just go and like
Yeah.
be with for a bit. I'm like, okay, I'm good. For me, I also enjoy kayaking. I live kind of sort of close to the ocean, but so I think just getting out and kayaking, getting sort of away from everything for a bit, really helps me as well. What about you, Amanda?
That's a really good question. One of the places I feel the safest, and I think it goes back to my childhood with my mom. My mom we have 4 kids in our family, and a lot of us played sports. And so we'd have to drive up to Ottawa quite often to play hockey and then drive back home to our home community. So I feel really safe in the car. So now what I do is if I want to kind of just de-stress, I remove myself from stressful environments and I go to my car and I sit and I just kind of take in the world around me and people watch in my car and answer my emails and pretty much anything. It's so funny because everyone's always like, Amanda, you're always in your car, but it's because it's a safe place.
Yeah, I love that you said people watching.
Yeah. Always people watching. People are interesting.
Yeah. Oh, so we're coming to the end here, but once again, I'd like to thank you, Lauren, for speaking with us today. We really appreciate it, and it was great learning more about your role in the community to promote mental wellness and your experience at developing your workshop. So yeah, it was a great pleasure speaking with you.
Yeah, well, thank you so much for having me. It was a fantastic time hanging out with you both.
And before we do go, I just want to ask, was there anything else you'd like to share with our listeners?
Yeah, so our biggest event coming up will be on June 12th, 2022. It is our Ride, Don't Hide fundraiser. So Ride, Don't Hide is our annual fundraiser. We're finally going to have an in-person event this year. It'll be in Victoria. So if anyone wants to make the trek down here, registration is open right now, and we're going to be doing a big launch during Mental Health Week, which is also, by the way, Mental Health Week is May 2nd to 8th. So definitely encourage you to get involved in some events around that week. And yeah, I think that's the main thing I want to plug.
Well, thank you again for being here. And we look forward to maybe crossing paths with you in the future.
Absolutely.
Many thanks to Amanda and Taylor for doing the interview, and a big thank you to Lauren for giving us some context on awareness and battling stigma around mental health and how to engage our communities. As mentioned in the interview, Lauren Sykes is the Resource Development and Events Coordinator in Victoria for the BC division of the Canadian Mental Health Association. If you want to learn more about what Youth 2020 CAN is doing and get involved, head over to youth2020can.ca. If you want to learn more about what the BC division of the Canadian Mental Health Association is doing or would like their resources, head over to cmha.bc.ca. As we come to a close, I would like to thank our guests, Ashley and Lauren, for joining us on our episode today at A Sound Constitution, and a big thank you to Amanda and Taylor for doing both the interviews. Lastly, I would like to thank you, our listeners, for joining me, Habin, your host for this episode. Today, we talked about the supporting role in the context of mental health, and I hope this encourages more conversations about mental health and illnesses, and motivates you to share when you are struggling with your loved ones. For details and show notes from today's episode, or to follow along on what's happening this season, check out our Facebook at A Sound Constitution and our Instagram at CHLY A Sound Constitution, all one word. If you've missed parts of this episode or would like to listen to this episode again, or episodes from previous shows, please check out our YouTube at A Sound Constitution. Otherwise, we'll see you next week, where we'll be discussing reproductive health. Be well.